Welcome. In this video, we'll dive into essential English phrases and vocabulary for successful medical tourism experiences. Whether you're a patient seeking treatment abroad or a medical professional interacting with international clients, mastering these communication skills is crucial. So, grab your notebook and get ready to learn. Let's start with Vocabulary for Patients, Part 1, Scheduling and Appointments. Let's start with navigating appointments. Practice saying phrases like, I'd like to schedule an appointment, can I reschedule, and I need to cancel. Remember, clear and concise communication is key. Make an appointment. I'd like to schedule an appointment, please. Can I book an appointment with doctor's name? Reschedule. I need to reschedule my appointment. Can I move my appointment for date time? Cancel. I need to cancel my appointment. Confirm. Can you confirm my appointment on date time? Part 2. Medical History and Symptoms. Now, talking about your health, we'll cover phrases like, my medical history includes, and I'm experiencing. Feel free to pause the video and practice describing your symptoms in detail. The more specific you are, the better. Medical history. My medical history includes brief explanation of existing conditions, medications, allergies. Symptoms. I'm experiencing list of symptoms. Pain. The pain is describe location, intensity, duration. Medication. I'm currently taking a medication. Allergies. I'm allergic to this. Part 3. Procedures and tests. Understanding treatments is crucial. We'll learn to ask questions like, what is the diagnosis? And what are my treatment options? Remember, don't hesitate to clarify any doubts you might have. Diagnosis. What is the diagnosis? Treatment options. What are my treatment options? Risks and benefits. Can you explain the risks and benefits of this procedure? Cost. How much will it cost? Recovery. What is the expected recovery time? Part 4. General communication. Feeling lost? No worries. We'll cover essential phrases like, I don't understand, and can you repeat that? Effective communication involves both speaking and listening, so actively engage with the examples. I don't understand. I'm sorry, I don't understand. Could you please rephrase that? Can you repeat that, please? Please repeat that for me. I need help. I need some help, please. Thank you. Thank you for your help. Now we will study vocabulary for medical staff. Part 1. Greeting and introducing oneself. Make a good first impression. Practice how to introduce yourself warmly and professionally using phrases like, hello, welcome, and my name is Dr. Nurse. Hello, welcome. My name is Dr. Nurse. Your name. How can I help you today? Nice to meet you, Mr. Miss. Part 2. Taking medical history. Getting the right information is essential. We'll learn how to ask questions like, tell me about your medical history, and do you have any allergies? Remember, be patient and attentive to the patient's responses. Tell me about your medical history. Do you have any allergies or any medications you're currently taking? Can you describe your symptoms in more detail? Part 3. Explaining diagnosis and treatment options. Delivering clear explanations is key. We'll practice stating diagnoses like, based on your symptoms, I believe you have, and explaining treatment options effectively. Remember, simplify medical jargon for better understanding. Based on your symptoms and examination, I believe you have diagnosis. The best treatment option for you is recommended treatment. However, there are other options available, and we can discuss them in more detail. Providing instructions and answering questions. Be a trusted guide. We'll cover how to give clear instructions like, please take this medication, and answer questions patiently using phrases like, I understand your concerns, and don't hesitate to ask. Please take this medication 3 times a day. It's important to rest for the next few days. I understand your concerns. Don't hesitate to ask if you have any questions. I'll need to consult with doctor for that information. Ending the consultation. Do you have any other questions for me today? Thank you for coming in. Please come back if you have any problems. Here are some extra tips for effective communication. Speak slowly and clearly. Use simple language and avoid medical jargon. Be patient and listen attentively. Encourage questions and answer them thoroughly. Use nonverbal cues like facial expressions and gestures to convey empathy and understanding. That's all. Remember, mastering English for medical tourism is a journey, not a destination. Keep practicing, have fun, and be confident in your communication. Thanks for watching.